Okay, so today I wanted to go over COPD and restrictive lung disease, some of the mechanisms for that, and some examples. Chronic obstructive pulmonary disease is when you have damaged the alveoli walls and thus have decreased elastance. And if we remember, elastance is what allows our lungs to force air out. And so if it's harder to collapse the lungs, you can't force as much air out. So you're gonna have, it's not gonna collapse as much before all air is exhaled. So there's gonna be air left over if you don't force it out. So for someone with emphysema, they can't rely on that elastance to pull, to push air out. And so they have to use accessory muscles and really puff out. So with emphysema, it can be very easy to breathe in. So you can get air and you'll be well oxygenated, but to get it out, you have to work so much harder to blow the air out because you have decreased elastance in the alveoli walls. So that's an example of COPD. Restrictive lung disease is when it's not that the walls are damaged. Well, they are damaged, but the ciliary escalator or the cilia are damaged, and so you can't excrete mucus from your lungs. And if you have a buildup of mucus, then there's a lack of oxygen exchange between the membranes. And so you'll find yourself in a state of hypoxia because the oxygen is just not transferring. And so between emphysema and chronic bronchitis, one being COPD and one being restrictive lung disease, in emphysema, you'll find what we call pink puffers, where they're super skinny because they're trying to blow out air so forcefully, which burns a lot of calories. So they'll be super skinny, but they'll have enough oxygen, so they'll be pink because they're well oxygenated. But in chronic bronchitis, if you can't clear the mucus and oxygen levels are low, you're in a hypoxic state, you'll appear as blue. So they call them the blue bloaters. So they're not wasting energy on blowing out. They can blow out and breathe in just fine. It's just that they're not exchanging oxygen efficiently. And so if you can't exchange oxygen efficiently, then your activity levels go down, and then you're usually overweight in that case. So that's just two examples of COPD and restrictive lung disease. Emphysema has an air trapping mechanism wherein you have decreased elastance, and so it's more difficult to expel air out of your lungs.